Hello everyone, I hope all of you are doing fine. I'm Shabana this side, your friend and colleague. So I'll be discussing in short about the gynecology preoperative list prioritization station. So as we all know, it's going to be a structured discussion task in which you will be sitting face to face with your examiner, right? You will be tested mainly in 4 domains, and these are patient safety, information gathering, communication with colleague, and applied clinical knowledge. So I'll just discuss about the important points in very short in all these 4 domains. So in patient safety, it's very important to mention about valid written informed consent. You have to mention about the patient information leaflet, pregnancy test in all women of reproductive age group, preoperative investigations, blood samples for group and safe, or for cross-match if patient is at increased risk of bleeding, prophylactic antibiotics, thromboprophylaxis, mention about WHO surgical safety checklist, principles of enhanced recovery program, and in complicated cases, you need to mention about involving the MDT and your consultant. Yeah. Coming to information gathering, here you have to identify the surgical risk factors and how to avoid any risk or complication before, during, and after the procedure. For example, if the patient is morbidly obese, we know that there can be risk during the surgery. Surgery can be technically difficult, and also there will be increased risk of infection, pain, and thrombosis. So we need to mention about these risks and how to minimize the risk and complications. So also in each case, we need to ask for more details, like if the patient has any medical comorbidity, previous surgery, and mention about going through case notes if needed. Yeah. Coming to communication with colleague, here, of course, you will be tested in communication with examiner. So when you will meet your examiner, greet your examiner with a smile, say hello, introduce yourself, and there has to be eye-to-eye contact. Yeah, you will be the one who will lead the discussion. Again, there is need of MDT in complicated cases. For example, you will be involving diabetologist or dietitian in patient on insulin pump, hematologist in patient with history of DVT, or if the patient is on low molecular weight heparin. Also, you should know your limitation and involve your consultant and other specialties when needed, because you will be managing your patient as ST5. Yeah. Coming to applied clinical knowledge, again, you have to identify the surgical risk factors and how to avoid any risk or complication before, during, and after the procedure. Discuss the advantages and disadvantages of each surgical approach. For example, if you are discussing about laparoscopy, advantages are, of course, shorter hospital stay, quicker recovery, early discharge. Disadvantages are like risk of surgery and anesthesia is there, pain, infection, bleeding is there. And during laparoscopy, of course, there is risk of damage to internal organs like bowel, bladder, blood vessels. Yeah. And also you need to discuss about how to minimize these complications. Then mention about samples taken, and there is need to label them correctly, and then sending them to the laboratory for histopathological examination. Like in cases of hysterectomy, labeling correctly is very important. Yeah, and in molar pregnancy, where you will mention section evacuation, then all the products of conception needs to be sent to the lab after correct labeling. And in the end, you will mention the order of the list according to the risk. So, for example, if the list mentions that the patient has latex allergy or she's on insulin pump, then of course these cases should be first on the list. And also you have to see like whether you need to postpone the surgery if condition is not optimized, or if alternatives were not discussed. So these are the important points which you will mention in these 4 domains. And as it's going to be a structured discussion, so yes, you have to be very confident and very calm and composed, because you will be sitting face to face with the examiner. Okay, so I hope this is helpful, and hopefully I will try to post my next audio as soon as possible. Until then, goodbye and take care.